Hey guys, today we're going to talk about referred pain. Now, what is referred pain? Basically, it's pain that is coming from a different location than you hurt. So, for example, if you step on a dog's tail, he's going to bark through his mouth, right? You're not going to mess with the mouth. You'll take the pressure off the tail. But for this video, I'm going to actually use a volunteer here. So, Jared, thank you for coming up here.
All right.
Tell you what, let's just have you stand right there. Okay. Wow, looks like I didn't quite get that right there. A little off center there. Okay, the first thing is the pancreas. The pancreas is an organ. Let's see, stand right through here. Pancreas is right underneath the left rib cage, right through here. And it actually even crosses over sometimes, so it's right here. If you have inflammation in your pancreas, it can be referred to the left shoulder or the back, okay, right through in here. Or it doesn't necessarily have to be referred. It could just hurt right over the pancreas right there. Now, the gallbladder, which is the opposite side, right underneath the rib cage right through in here, will usually refer pain to the shoulder area right through here. There's a little muscle called the levator anguli scapula muscle. And it's this, people will just kind of want to massage on the right trap, but it's really this tiny little muscle right through in here that raises up the shoulder like this. And that's where you'll normally get it. So it'll be a tight knot. It'd be painful. This is gallbladder for sure. And also, what's happening is there's a little nerve that goes underneath the diaphragm, okay? And that nerve is called the phrenic nerve, and it goes all the way to the neck, the cervical vertebra, like C3, 4, and 5. So some of these nerve roots make up something called the phrenic nerve. So you can have pain in the right side of your neck right through in here. It can even refer to the right temple through here and the jaw and cause a headache on this side. The pain can be right through in here, okay? And it can even create tension in your neck and pull out the vertebra to one side and pinch the nerve and cause pain anywhere down the right arm. I've seen that all the time, even to the fingers right through there. Now, the liver is right through in here. If the liver is inflamed or congested or not working, that can cause pain also in the right shoulder, but primarily it's going to be in this muscle right through in here, the rhomboid on the right side. Now, over here we have the spleen, which is just underneath the rib cage. So the pancreas and then the spleen is right here. That can cause pain on the left shoulder right through in here. And the heart is just off the midline right through in here. And by the way, the heart's the size of your fist, and that will cause pain down the left arm right through in here. It can cause pain in the shoulder or even the jaw on this side. Now, put your finger on your belly button. Okay, good. So his prostate is right down here. That can refer pain to the backside. Now, if you had ovaries, what will happen is it'll be just to the left or just to the right of that area right here. That will cause pain in what's called the sacroiliac joints. So the sacroiliac joints on the right side and the left side. There are little joints that connect the pelvic bone to the sacrum right here. So it'll be right here and right here. So if you have pain on the right side, you're female, that would be the right ovary. Pain on the left side right here, that could be the left ovary. And if you're a male and you have a prostate, the pain could be right in the lower back right through in here. Now there's also something called sciatica pain, and that is pain that runs down the back of the leg and go all the way to the lower part of the foot. That's coming from a pinched nerve either in your back or one of the muscles in your butt. You have several muscles there, and one is called the piriformis, and that can go into a spasm and tighten up the nerve and cause sciatic pain on that side. Sciatic pain usually comes from either a tailbone injury, some injury to the lower back, or prolonged sitting where you lose the curve of your lower back, in which case you need to actually put that curve back in. And the last organ we're talking about is the kidney. Okay, so the kidneys are located here and here, okay, in the kind of the upper abdomen, deep inside. So in the back, if you have 12 vertebrae right through in here and you have the 12th rib, the kidneys are like just right underneath that right here and right here. So if there's a problem with the kidney, whether it's a kidney stone or inflammation in your kidney, you can have pain anywhere underneath the last 12th rib to the spine. It's this little triangle right here, somewhere in the upper back on this side or this side right here. Now, if there's a kidney stone that dislodges from either kidney that goes down through the little tube called the ureter on its way to the bladder, This could cause pain in the groin area. So the problem is not in the groin, it's actually in the ureter, that little tube there. Now the thing to know about referred pain is they don't know a lot about what causes referred pain, where it could be some type of problem with the nerve circuitry or some soft tissue, whether it be fascia or ligament or a tendon or a muscle. So the next point I want to talk about is what percentage of the population has referred pain versus pain that actually is coming from the actual pain source. So the answer to that is it's a large percentage. I would guess to say that 50–60% of the pain that an average person has is referred from another area of the body, especially if you hadn't had any injury at all to an area and you start hurting for no reason, then suspect it could be referred. Now, there's a couple foundational things that you need to do if you have referred pain. Obviously, it involves an organ, and that organ usually has a problem because the person's diet is not good. So you could treat this area over and over and over and even get rid of the pain, but it's going to keep coming back until you fix the diet. Now, if you're not new to my channel, you know what the solution is. But if you are someone that is new to the channel, there's two things you need to do: healthy keto and intermittent fasting. Both of these actions together can help clean up these organs and actually help to give them a rest, because you're going to be doing intermittent fasting. And you're going to find the inflammation is going to go way down, the organ is going to eventually heal, and you're going to be out of pain. Now, as far as myself, I had right shoulder pain for 12 years, and I did not make the connection between my gallbladder and this right shoulder. I would get massages, I would get chiropractic treatments, and it would last for a nanosecond and it kept coming back. Little did I know it was related to my diet. And after I eventually found keto, intermittent fasting, and did that, I've had absolutely no pain in that right shoulder for years. But usually the person will swear it was from an old injury that they had and that's what's responsible for it, but it's really related to their diet. So if you're not on healthy keto and intermittent fasting, do yourself a favor and try it and see how much it can help you. And the very last thing I want to say is that if you go to a practitioner and you get treated and you need repeated treatments over and over and over for months and months and months, suspect that there is this situation going on in your body and isolate the area that you have, focus on that, and ignore this because this is the symptom, this is the cause. All right, thanks for watching. And if you haven't already subscribed, click the red button below and that little bell icon so you can be notified of all the new videos that I'm going to be releasing. And I have some very cool and interesting videos coming up in the next coming weeks. Plus, in addition to that, you'll be notified of the live Q&A sessions that I'm going to be doing throughout the week, and you don't want to miss those as well. So stay tuned for more great content.